The vertebral column is a chain of bones, vertebrae. Most of us have 33 vertebral segments. Usually, the number of cervical vertebrae, thoracic vertebrae and lumbar vertebrae are 7. And 5. The segments below them are fused into a sacrum and a coccyx. Each vertebra has a vertebral foramen, so that a vertebral column has a vertebral canal, where the spinal cord lies. A vertebra has a body. A spinous process. A pair of transverse processes. A pair of pedicles. A pair of laminae. A pair of superior articular facets. And a pair of inferior articular facets. These structures form a vertebral foramen. A pair of superior vertebral notches. And a pair of inferior vertebral notches. The shape of the vertebrae is different level to level. The cervical vertebrae are smaller than the thoracic vertebrae and the lumbar vertebrae. The body of a typical cervical vertebrae is small. It has uncinate processes bilaterally. The body of the thoracic vertebrae is in a cylindrical shape. In the transverse section it looks like a heart. The thoracic vertebral bodies have costal facets for the joint with the head of the ribs. The lumbar vertebrae are large. The body of the lumbar vertebrae is wide laterally so that their transverse section has an oval shape. One of the distinctive features of the cervical vertebrae is that they have a transverse foramen in each transverse process. And the transverse process has an anterior tubercle and a posterior tubercle. The transverse processes of thoracic vertebrae have facets for the joint with the tubercle of the ribs. The transverse processes of lumbar vertebrae are long and thin. They have an accessory process. The vertebral foramen of cervical vertebrae is triangular for the cervical enlargement of the spinal cord. The vertebral foramen of thoracic vertebrae is small and circular. The vertebral foramen of lumbar vertebrae is triangular. It's smaller than the cervical ones but larger than the thoracic ones. The spinous process of cervical vertebrae is short and split into 2 parts. The spinous process of thoracic vertebrae projects downwards. The spinous process of lumbar vertebrae is horizontal and quadrangular. In the cervical vertebrae, the facets of the superior articular processes face posteriorly, while the inferior ones face anteriorly. In the thoracic vertebrae, the facets of the superior articular processes face postero-superolaterally. While the inferior ones face antero-inferomedially. In the lumbar vertebrae, the facets of the superior articular processes are concave and face posteromedially. The processes also have a mammillary process. The facets of the inferior articular processes are convex and face anterolaterally. The sacrum is a triangular fusion of 5 sacral segments of vertebrae. Its dorsal surface is convex and the ventral surface is concave. It has a sacral canal. The first sacral segment makes the base of the sacrum. The vertebral foramen in base is triangular. The base has a pair of superior articular processes. The lateral parts of the sacral vertebral segments make the ala in each side. In the ventral surface, we can see 4 pairs of the ventral sacral foramina. In the dorsal surface, we can see the median sacral crest, the intermediate sacral crests, and the lateral sacral crests. As well as the dorsal sacral foramina. At the inferior end of the sacral canal, there is a sacral hiatus in the dorsal side. The coccyx is a small bone and consists of 4 fused vertebrae, usually